Human reflexes are protective devices that our nervous system uses. Reflexes are simply predictable, rapid, involuntary responses to stimuli. They help us maintain homeostasis. We have two types of reflexes. Autonomic reflexes involve smooth and cardiac muscle and glands, those things that are controlled by the autonomic nervous system. Somatic reflexes involve skeletal muscle. That is what the somatic nervous system controls. A reflex arc starts with a stimulus. Now there has to be a receptor for this stimulus, which picks up the stimulus and using a sensory neuron sends it to an integration center. The integration center will be in the brain or the spinal cord. Because this is a reflex, the integration center has already made a decision on how it's going to handle this. It doesn't really think about it at all. It simply sends information out along a motor neuron to an effector. Now the effector will vary depending on whether this is a somatic reflex, in which case skeletal muscle will be involved, or if it's an autonomic reflex, either smooth muscle, cardiac muscle, or a gland will be involved. Stretch reflexes help prevent us from overstretching a muscle. These are also very important to help us maintain posture. You can test stretch reflexes using a reflex hammer. There are two that are frequently checked. One is the patellar reflex. Here you simply strike the patellar tendon to see if you get the leg to kick out. This helps assess the spinal cord between L2 and L4 because the nerves that control this come out there. The Achilles reflex involves you striking the Achilles tendon on the back of the foot. These nerves come off of S1 and S2, so this helps you assess the effectiveness of these nerves. There are some superficial reflexes that are mediated by the spinal cord. They require upper motor pathways to the brain as well as cord-level reflexes. These are stimulated by receptors in the skin. The plantar reflex, or the Babinski reflex, requires the use of a reflex hammer, but this time you're only going to use the handle. This helps assess the pyramidal tracts, the area where the motor nerves cross in the upper part of the brain. You stroke the handle of the hammer across the fleshy part of the foot. In a normal response, the toes curl downward. In an abnormal response, you get the Babinski sign, that is, the toes flare. So sometimes when people have a head injury, you see the doctors down at their foot doing this because they're trying to assess if there's been damage to those upper motor tracts. This will not work in infants because their myelin sheaths are not fully developed until something like 18 to 24 months of age. They show a positive Babinski sign for that reason. Cranial nerve reflexes can be checked using pupillary reflexes. If the reflexes are absent, this can indicate severe trauma or some sort of deterioration of vital brain tissue because of a metabolic imbalance. For example, if oxygen didn't get to the brain for a while, there could be metabolic damage as a result of that. You need a flashlight in a dark room to do these. The pupillary light reflex occurs when the pupil constricts in response to light. This is what we call an ipsilateral reflex. In other words, you shine the light in the right eye, the right pupil constricts. It happens on the same side. There is also a pupillary reflex known as the consensual reflex. Here, you only shine light in one eye and you keep the other eye shielded from the light. While the one eye should contract because the light is in it, that would be the pupillary light reflex, the other eye will have a slight contraction of the pupil as a result of the light shining in the other eye. This is the consensual reflex. This is what we call a contralateral reflex because we stimulate on one side, but we see the reflex on the other side. When you're reporting reflex test results, if they are absent, that means there was no reflex noted. A 1+ indicates a hypoactive or weak response. A 2+ is a normal response, and a 3+ is hyperactive, and hyperactive can also indicate nerve damage.